Thank you for joining us for the impact of cancer-related cognitive impairment on patients and caregivers, presented by Linda Hutkin-Slade. My name is Gabrielle Winther. I am the lead community navigator and CAR-T specialist here at Cancer Support Community, and I will be moderating this session. Before introducing Linda, I have a few reminders about this session. First, while the session is being recorded and will be available for viewing after the event, continuing education can only be earned by attending this live session. If you wish to receive a continuing education credit from participating in this session, you must complete an online evaluation form, the link which will be made available at the end of the symposium. If you would like to ask a question during the presentation, please do so using the Q&A feature in Zoom. We will address questions throughout the session, and we will do our best to address all the comments and questions in the Q&A at the end of the presentation. To turn on closed captions, please click on the CC button in the Zoom toolbar. Now I would like to introduce our presenter today. Linda Hutkin-Slade is a licensed clinical social worker and certified oncology social worker at Sharp Grossmont Cancer Center. As a 14-year cancer survivor, she brings personal and professional experience to her work with patients and families as they move through their cancer journey. Linda spearheaded efforts to develop and implement an innovative continuum of care across Sharp Healthcare to address cancer-related cognitive impairment. She has worked extensively in healthcare, both in direct service and in management. She is active in the Association of Oncology Social Work, serving as conference co-chair in 2023 and currently as co-leader of the Radiation Therapy Special Interest Group. Please welcome Linda.
Thank you, Gabrielle. I'm really happy to be here with everybody. And I wanted to mention that this is a topic that is near and dear to my heart. As Gabrielle said, I am a cancer survivor. It's 14 years this week, and I had significant chemo brain, as it was called back then. So I'm really looking forward to sharing this. This is a passion project for me. And in fact, at our system, we have different award levels, and we just were recognized at the system level for this project. So without further ado, I'm going to tell you I have no disclosures. And today we're going to be talking about what is cancer-related cognitive impairment, the patient and family experience, and what's available to help. So when patients first enter the realm of cancer, they have changes that occur. And these come as a surprise because at first, so much is going on. It takes a long time, or maybe not such a long time, for patients and families to start realizing that the brain isn't working the way it did before. And the medical team doesn't talk about it until the patient typically complains or mentions their symptoms. And patients are upset and scared. And usually they'll say something like, I think I'm getting dementia, or I have Alzheimer's. And all of these things add additional concerns and worries, anxiety, stress, sadness, and isolation. And the patients don't know what's wrong or how they can fix it. And these symptoms are collectively known as chemo brain. So what is chemo brain? Most are going to agree that this is a decrease in mental sharpness, an inability to remember certain things. They have trouble finishing tasks or learning new skills. They are easily distracted. They find that they can't focus. They may have a short attention span. If you say something like shiny or squirrel, that tends to describe them very much. They really have trouble with multitasking, like answering the phone while cooking or keeping track of a recipe. And they find that they are more disorganized, that they're slower to think and process. They have issues with word finding, and just simply their brain doesn't work like it used to. And it goes by many names: chemo brain, chemo fog, but it's formerly known as cancer-related cognitive impairment. And I'm going to probably refer to it as CRCI and chemo brain throughout today. So let's hear from Milda.
When did I first notice memory problems? This is difficult to say when I first noticed memory issues because I am a naturally anxious person, and I do understand that anxiety can play a role in memory. So I would say probably, if I had to choose a specific time where I really felt like my memory was going way downhill, it would have been about 3 months after I started tamoxifen. Um, and I ended up falling prey to a very basic scam, and I gave away my social security number over the phone. And this was literally just several days after I'd done a cybersecurity class for work, where they actually outlined that specific kind of scam that I had just fallen prey to. So I really felt like there was something wrong, like I wasn't retaining any information. And I went to my oncologist and I kind of complained about this, and he set up a brain MRI because of obviously the concern about metastasis to the brain and what was going on. I think I was kind of freaking out. um, that came back negative. So I was thinking, great, I survived cancer. I got a clean bill of health. Cancer is like your body trying to kill you. So now, because my body hadn't succeeded in killing me yet, now my brain was determined to ruin my credit score.
So I should have mentioned that you should try to note when she lost track of what she was saying. And it was really noticeable because she paused, she looked to her notes. Oops. So when patients first complain, this is what they hear. Oh, you have chemo brain. Unfortunately, it's a side effect of your cancer treatment, and you're going to need to live with it. And hopefully, it's going to resolve soon. So here's some questions for you. And we have a poll, which, uh, sorry, it's not showing up over here. Polls found it, sorry. So I'm going to ask you some questions and I want you to take a moment to answer this. So, do you ever find that you forget phone numbers or forget names or forget where you parked your car or perhaps lose track of items around the house or forget directions or forget the groceries that you went to the grocery store specifically for, or forget the content of conversations, or maybe forget store locations in the mall, forget why you entered a room, or perhaps misplace your wallet or forgot your keys or even forgot appointment date. So I'll give you a moment here to answer these questions and let's see what we get. We probably should have had all of the above. All right, so I'm going to end the poll. Let's see what we've got here. Oops, we're at 83%, but all right, we're going to end the poll here. So let's see what happened. So you can see what's happened here. I hope you can see this. So 52% forget phone numbers, 79% forget names. That's a pretty high percentage. 59% forget where you parked. 73% of you lose items around the house. 63% of you forget the groceries you went to the store for. Directions, 41%. It's probably not a fair question to ask since most of us have some sort of GPS app on our phone. Forget why you entered a room, 83%. Forgot appointment dates, 47%. Forget where you put your keys, 49%. Losing your wallet, 27%. Forgot conversations, 44%. And only 9% of you forget store locations in the mall. So here's the thing about this. Not all memory failures are cancer related. And the reason for this is that we all have normal forgetting. And the reason why this happens is because our brain guards its limited memory storage networks. Believe it or not, we don't have endless brain cells for memory. And so the brain itself sorts out what's important, what's not important. As an example, it is more important to remember sequence for work than it is to remember what you ate for lunch. So even people who haven't had cancer or cancer treatment have these normal forgetting. And this happens especially for anyone when they're stressed, fatigued, hungry, or inattentive. And the problem for cancer patients and cancer survivors, and again, I'm going to use those two terms intermittent either way, sorry, is that their memory issues, when they happen, they become heightened. And so they lose track of what's a normal thing to happen. And one of the things then that happens is when patients are noticing that they have a cognitive impairment, this really contributes to a diminished or reduced quality of life. And there are all sorts of consequences for this. There's difficulties often with family members and friends. People sometimes are not able to return to work, or it slows their return to work. And even more importantly, is that it may interfere with treatment plans. And why is that? It's because if somebody forgets that they're supposed to get labs, or forgets to take their medication, or forgets to follow up with a doctor, that can lead to both increased side effects and reduced survival rates. About 75% of patients who have had cancer treatment are going to experience some kind of cognitive impairment. And for a poor 35% of them, that's going to persist for months and years following the treatment. And what happens is typically patients will mention this to their healthcare team. Sometimes their concerns are minimized. And some doctors will say, and have in fact said to people that I'm working with, that's not a real thing. It's because you're in menopause or something like that. But when doctors try to figure out what to do with this, they struggle with not only the diagnosis of this, but the management of this dysfunction. And there's a great deal of variation amongst patients because these effects can happen very quickly and only last for a short time, and others have long-term mental changes. In some situations, the changes can be subtle, and others might not even notice these changes at all. But the people who are having these problems are very aware that their brain isn't working the same way as it used to. And most don't tell their cancer care team about this until it starts to affect their everyday life. There's lots of theories about this: inflammation, aging, pre-existing executive functioning problems, hormonal treatments, which of course in breast cancer and prostate cancer, patients are often taking medications that suppress their hormones. And Milda mentioned that being on tamoxifen is something that has impacted her memory. And of course, the influence of genetics comes into play too here. There is actually an International Cognition and Cancer Task Force that's focusing on CRCI, and they actually met, I think, last year in San Diego. I did not get to go. That's where I live, but I didn't get to go. Now, what we do know is that chemo isn't the only culprit. And patients often will say to me, I didn't have chemotherapy, but I'm having these memory issues. But most of our patients are having some sort of combination, right? They may be having surgery, chemo, or radiation, or a combination thereof. If you've ever worked in non-oncology settings and have worked with patients who have had surgery, you have certainly witnessed patients having post-operative cognitive dysfunction. It's well documented in literature, and it affects mostly the area of memory, and this effect is transient. Now, with chemotherapy, we also know that it can cross the blood-brain barrier and it affects both the gray and the white matter. They don't fully understand the mechanism for these changes, but they think that there's some sort of direct toxicity to the brain cells, and of course, inflammation and alterations to neurotransmitter function. Now, people are often surprised by radiation having an impact. Of course, if somebody has whole brain radiation, that is understandable. But with radiation, a lot of this depends on whether or how much of dose and duration and location of that radiation. And there's also an effect in the white and gray matter. Now, fatigue affects most patients post chemo or during chemo and during radiation specifically, and fatigue plays a big part in cognitive in cognitive function. And then one other thing that people tend to lose sight of is in radiation, depending on the body part that's being radiated, there's blood flowing through these areas, right? There's our veins pumping blood. That blood's getting radiated and it goes up to the brain as well. So there's lots of different things that come into play here. Also, most people come into cancer with other pre-existing things like diabetes or high blood pressure. And then, of course, during cancer treatment, we often see people not moving as much. So there could be a lack of exercise or loss of muscle mass. Many patients are put into menopause if they weren't there already. And then, of course, patient age. All of these things play a part. Now, one of the things that makes things very difficult with chemo brain and CRCI is it's hard to study. So patients with CRCI tend to perform within normal ranges on the available neuropsych testing. So neuropsych testing is not sensitive enough to really pick up these changes. But despite passing these tests, the patient still will report forgetfulness and other cognitive challenges. And so we are really having to base it off of the patient self-report. Now, with functional MRI, you can see, and I'll show you an image in just a bit, where patients have to use more diffuse areas of their brain than somebody who has not had cancer. And patients with neuropsych testing, they get the right answers, but they have to work much harder to do so. So the first reports of chemo brain go back to the 1990s, and not a surprise, it's mostly breast cancer patients who are speaking up. It's not a surprise because women tend to be more proactive about what's going on with them. But during this time and subsequently, there is a clear demonstration that cancer and cancer-directed therapies can affect cognitive function. And the advanced brain imaging studies that we have now can show us the structural and functional brain changes both before and after treatment. And we also have studies that demonstrate these changes in cognition and everyday functioning and behavior because of cancer and cancer therapies. So this is one of my favorite pictures. This was when I saw this back in probably 2013. I wanted to run through my office building and say, oh my gosh, look, here it is. Here's proof. So this picture on the left is a before and after chemo, and these very helpful arrows are pointing out these hues of yellow and lime green. And what those represent are a significant decrease in the usage of glucose in the brain. And the brain uses glucose as energy. So you can see here with functional MRI what is happening or what has happened with chemo. This is These are images from a study that came out of Stanford in 2009, also quite a while ago, but still significant. And what you see on the left is the brain activity of a woman who had no history of cancer. And when she's given tasks that involve storing memories, she has more activity in the prefrontal cortex than women who had chemotherapy. And on the right image, you see how a breast cancer survivor who had chemotherapy has to use more diffuse areas in her brain when she's asked to recall memories. So this is when patients are like, what happened? These images are really helpful for them to see that it's not just they're losing their mind. There is actually something going on in the brain. So there's lots of studies out there, and here are some general findings. One of the things that I find difficult to cope or wrap my arms around is that you can still see these changes 5 to 10 years after treatment has ended. But not surprising, the parts of the brain that deal with memory, planning, putting thoughts into action, monitoring thought processes and behavior, and inhibition are smaller and or less active after cancer treatment. So this is like impacting that prefrontal cortex where, young men before they're 25 and before it's fully developed are impulsive. You can see impulsive lower inhibition behavior in patients with CRCI. And I personally had that experience at the time. My CRCI was very severe. I was in a very upper management position in a social service agency, and I found myself blurting things out in staff meetings that I had no intention of saying, and had to implement the count to 10 before you speak, Linda, because it was getting me in trouble. So we also know that memory tests show patients are slower to learn new things and to take longer to recall what they know, and their response and reaction times are slower, and their attention and concentration often suffers, and they have more trouble recalling information and using language. Our pet therapy volunteer just came in and she wanted me to see her costume. Sorry about that. Okay, so let's figure out. So, what happens if, like Milda, you tell a scammer your social security number, or you miss an important deadline because you totally forgot about it, or you can't figure out whether you turn left or right at the end of the street to go to the grocery store, or you forget to turn off a burner, or you blurt out something embarrassing. All of these things, these memory misadventures, result in embarrassment, anxiety, and stress. And so this piece that's really, really important to understand is the stress cycle in CRCI. So it's pretty simple. The patient gets cancer treatment and they start to notice memory and attention issues. And then because they're noticing them, they start to pay more attention to them and they get more stressed and worried and anxious. And because they're stressed and worried and anxious, they have more memory and attention issues. And the stress and anxiety climbs and they have more memory and attention issues. Others comment on these issues, and that stress and anxiety climbs. And so they notice more memory and attention issues. It's an ugly cycle that just repeats on itself. And what happens for most patients is that that information is there. They feel like there's holes in their memory, but the reality is they're still there, but it's been sent someplace else in the brain. So I always describe it to patients as this. Think of your brain like a big file drawer that holds all these memories and all the things that we've learned. CRCI, cancer treatment, causes this mess. It's like somebody dumped out the file, mushed it all around, and stuffed it back in the drawer. It's still in the file cabinet, but it just takes longer to find it. But if a patient is getting anxious about trying to find that, it doesn't come out. So I describe this in two other ways. It's like the words and memories are on a conveyor belt, kind of like at the airport where you see your luggage and you don't catch it in time and then it disappears and then it comes back, right? Or it's like the garden hose. If you've got your water turned all the way up and it is kinked, you just get a dribble of water. Or it's like the same thing with CRCI. You get a dribble of information or dribble of memory. If you can relax the hose or unkink the hose, the information comes through. So anxiety and stress play a huge part in cancer-related cognitive impairment. And of course, we know that anxiety impacts learning, decision-making, memory, the brain health itself, communication, and just shoots the stress level through the roof. So the emotional effects of CRCI are as important to understand as the physical part, right? So patients and families, survivors often feel that they are crazy and they are very, very sensitive to how others are perceiving them. They are hypersensitive to that perception. And so chemo brain, CRCI, can make it more difficult to do everyday tasks and things that they were able to do before. And this leads to very, very strong emotions. And they may find themselves getting angrier and more tearful. And they pick up the frustration of others. And that creates more struggle. So it's so, so important to help them learn to be patient with themselves, help their loved ones to be patient with themselves, and to accept where they are in their recovery because it's not likely to be their reality forever, but it is for today. So, how can we help? Well, unfortunately, there's no standard of care and there's no universal recommendations. And so the options to treat are limited. Now, people always ask me about medication. The problem with taking a medication, such as something for ADHD or the medications that we have patients who have dementia take, is that those do not work. Those medications that improve mental focus tend to not work and have horrible side effects that we don't want patients to have, such as increasing anxiety and interfering with their sleep. So, the best option really here is to identify what areas need help. So, there are things such as sleep disorders, depression, anxiety, those sort of things can be addressed that will help the patient experiencing CRCI. At the same time, psychotherapy, supportive counseling, CBT also helps manage that anxiety and stress. And there are formal cognitive rehab programs such as the Memory and Attention Adaptation Training Program that I'll talk about in a little bit. And what they do there is it helps patients anticipate problems and to compensate for their deficits. So I'm going to talk about these as key ways to help, and there's a lot of information that I can't fit into today's presentation, so please feel free to reach out for me for additional information if you like, but these are ones I'm going to focus on. So the first thing is we want people to identify their problem areas. It's so important for them to do this. It's something that really, really helps because if patients know what their triggers, what their clues and patterns are, they can create an action plan to deal with it. And so this awareness helps them self-monitor and know what factors they need to be looking out for. So, as an example, I experienced CRCI in prepping for this talk. And so it was a lot of work. I felt very stressed. I started to have word retrieval problems. And for me, I know when the text suddenly looks like just a big black box, I know that something's going on. And because I know word retrieval problems and I can't seem to read, I mentally take a step back and take a look and think to myself, what is going on? Oh, well, you've been overscheduled and you have not been sleeping as much as you should. You're feeling stressed and you have a lot of things going on. Maybe I need to do something. So it alerts me that I need to do more self care. So, another thing for us to do is to help patients manage their stress. So, as per usual, and all of us know about stress management, we talk about this all the time with patients. It's important to encourage both mental and physical activity. There is not one magic activity, but we know research shows us that diversity and novelty are important. So, just like our physical, if you do treadmill every day for your workout, your body adjusts, right? You need to do more and higher intensity. Our brains also adjust. So it's not as simple as doing Sudoku every morning. We want to mix it up. So socializing, taking a class, playing card games, doing some jigsaw puzzles or Wordle or Sudoku, playing along with TV game shows, going for walks and being mindful about it, really taking a look and moving around, moving body through physical activity, because that we know helps with combating fatigue. It improves our mood. We want to make sure that patients are also addressing these underlying issues like depression and anxiety, both in medical and non-medical ways. Excuse me. So a technique that's really helpful here is called memory reattribution. So remember all those things that we forgot? It's important for us to normalize memory challenges because it helps people de-escalate that stress response. It allows for survivors to smile, relax, and even use humor. And I used to get to the end of my street and get very anxious because I couldn't remember if getting to the grocery store meant I turned left or I turned right. And I would get so stressed out and so anxious about that I was almost incapacitated. Now that sounds really silly, but it was a real thing. And when I finally thought, actually, I can go either way. It doesn't matter. I was able to laugh at myself. It de escalated it and it allowed me to smile and relax about it. So it's important to help patients by reinforcing this memory failure reattribution. And this is probably one of the most critical things for survivors to learn because it de escalates the anxiety and stress. And that occurs when there's that memory failure. And we want to short circuit that stress cycle response. So, managing stress is a critical part of this because when we can interrupt that stress cycle and create a relaxation response instead, the patient, whatever the patient's trying to remember, that information's going to come through. So part of doing this is helping patients build skills and compensatory strategies. So we want to help them build skills to offset the challenging areas because unfortunately we can't give them back what they've lost, but what we can do is build on what they still have. So we're going to review a handful of these. All of these are in the MAT book, the Memory and Attention Adaptation Training book by Ferguson and Gillick, and that's in your resources. And then I would really encourage you to partner with a speech and language pathologist because they have additional tools as well. So, the first thing that's really important is to help the patients use their body and their brain because this relaxation response is going to be the anti fight or flight or freeze response. And so, if we look at deep breathing, that causes, when we deep breathe from our belly, that causes a relaxation response because the diaphragm is close to the vagus nerve, which is the longest nerve in the body. And when the diaphragm presses on the vagus nerve, it releases acetylcholine, which is a neurotransmitter, which results in a decrease in anxiety and increased focus and calmness. It's an involuntary thing, and you cannot be anxious and relaxed at the same time. So, when we change how we breathe, we can, to some extent, change how breathing affects our body. Another technique that's important is progressive muscle relaxation or PMR. And this works because when we tense a muscle group and we relax and we release that muscle, we not only relax back to the pre-tense state, but if you allow it to rest, it becomes even more relaxed. And so when you apply tension and release to each muscle group of the body, you create this relaxation response. And the more often a patient is able to practice this, especially in conjunction with breath work, the faster the relief occurs. So, this is something that I've practiced quite a bit. It literally takes me about 3 deep breaths and some tensing and relaxing of even just my fists to create a relaxation response for me. Now, a few things to keep in mind when you're working with patients about this is you don't want them flexing their muscles to 100%. We only want about 30% of strength of a flex. And then we want them to practice dropping muscle tension quickly so that we're over learning, over exaggerating this muscle tension. The reason why this is so important is that if a patient is aware and checking in with their body and aware that they're feeling tense, they can quickly apply this, right? So, the other couple of things to keep in mind with this when you're working with a patient is if a muscle or body part doesn't allow for comfortable flexing, so we want just a focus and a relaxation. We want people to be practical. We don't want them to induce pain. And then another thing to keep in mind is that distracting thoughts happen. They do. And so instead of trying to push them away, you just want to have the patient simply observe the thought and then go on listening to the next step. Quick relaxation is one that many of the patients we work with really like. You can apply it through the day. There's no practice, there's no recording needed. It takes seconds and it helps maintain relaxation despite stress. And it builds on the practice of the progressive muscle relaxation and improves mindfulness of keeping the muscles relaxed. And the best part, this is the part I love, is it can be done in 5 seconds or 5 minutes or a little bit longer if you want. So, we are going to try a quick relaxation. And what I would like you to do is to get yourself into a comfortable posture. You can be sitting down or standing up or lying down, whatever it is, but I want you to get comfortable. I want you to ground your feet and kind of relax your hands. And I want you to focus on your breathing. And so we're going to work on having some diaphragmatic breathing. So I want you to breathe in through your nose and out through your mouth. And I'm now going to get into my NPR voice as we do this. So we're going to be breathing in through your nose, out through your mouth. And I want you to check first and see where you're breathing from. Are you breathing from your upper chest or from your belly? If you're having difficulties with breathing from your belly, it can help you if you actually put your hands on top of your head, and that will help you breathe more into your stomach. So in through your nose, out through your mouth. All right. In through your mouth, in through your nose, and out through your mouth. I want you to focus now on breathing deeply into your stomach, in and out, and in and out. And as you're breathing, I want you to imagine calm as a color. What color is that for you? Is it blue? Is it pink? Is it purple? And you're breathing in and you're breathing out. And you're breathing in and you're breathing out. And now imagine your stress as a color. What color is that? Is it red? Black? What color is your stress? And you're breathing in and you're breathing out. And you're breathing in and you're breathing out. So now we're going to simply breathe in the color you imagined for calm, and you're going to breathe out the color that represents your stress. You're breathing in calm, and you're breathing out stress. And you're taking super slow breaths as you're breathing in the color that you imagined for calm, and you're breathing out the color that represents your stress. In and out. Nice, deep, super slow breaths. In and out. You're breathing in calm and you're breathing out stress. Super slow, deep breath. In calm and breathe out your stress. And when we're in with calm and out with stress. And when you're ready, open your eyes and return to me. Okay, so got some questions for you. We have another poll question here, and that's not it. Oh, found it. All right, gonna launch this poll for you. And I have a question. Come on a scale of 1 to 5, with 1 was I felt absolutely nothing, and 5, I definitely felt something. I want to know how relaxed you felt, and then what did you notice? Anything in particular? I'm going to give you just a little bit more, and then we'll see what everybody felt. Okay. All right, I'll get us up to 80% of participation. Or maybe not. Okay, gonna end the poll. Let's see what's here. So, good. At least most people didn't felt something, right? So, it looks like about most people hit around a 4, which is feeling something, and then a 24% if you felt, oh, do I need Let's share. That's share. Can't see the short answer. So maybe people want to put in the chat what they noticed, because I can't see what the short answer was. So just curious what people noticed. Tension going away. PMR. Yeah, I agree, Kelly. It is relaxing to lead PMR. More calm.
Linda, I am able to see all those.
Okay. Oh,
Somebody
you are.
said changing my hand position helped me breathe from my stomach.
Hmm.
Thoughts of evaluation of process. Controlling my breathing is relating to controlling my thoughts. My mind slowed down. I like the colors. It is easy to breathe in calm, green, and out stress, red. Whoever wrote that, that's the same colors I used. And then my breathing is more controlled and deeper.
Nice. Yeah, I really like this one. My when we teach the quick relaxation, people really like that one a lot. So somebody said it was a little difficult, so they're still at work. Yeah, I get that. That color visualization, yeah, it does take a minute to figure out colors too. But somebody else said even before getting to the colors, they felt more relaxed just focusing on the breath. Anyway, nice. Good. Great. Okay. Well, now I'm going to share with you one of my favorite techniques. This is a favorite of mine. This is the method of loci. And this is an ancient and tried and true. It dates back to 477 BC. So you know it works. And the way this works is that it's a visualization method, and it's using both the visual and sensory association. So they're using, sometimes making things richer helps people with remembering things. So what happens is people are given some items and they're placed in these highly familiar yet imaginary locations. And so the information is then recalled because the patient or whoever's using this walks the same route and converts those images back into the facts that they represent. And so we are actually going to also do this. And I'm and I'm going to ask you later to recall the items that I'm going to give you. So what I want you to do, especially now that you're nice and relaxed, I want you to close your eyes and I want you to think of either your home or your body, and I want you to visualize different locations. So this could be in your house. When you come in the house, you have, you go into your living room or your kitchen or your bedroom or whatever, or you can use your body, different parts of your body, like your head, your back, your hands, fingers, whatever. And so you want something that's familiar. So this is a good template. And I'm going to give you 5 items, and you're going to put one item in each space, whatever it is that you determine it to be. And it helps if you can visualize each of these items as exaggerated or absurd. And you're going to describe to yourself as you're placing those items, you want some vivid details. So I'm going to give you 5 items right now. So hopefully you're ready, kind of set what you want to do. The first item is a bag of carrots. The second item is a gallon of milk. The third item is duct tape. The fourth item is a bag of frozen peas. And the fifth item is toilet paper. Okay, carrots, gallon of milk, duct tape, toilet paper, frozen peas. Okay, so when we get towards the end of our session, I'm going to ask you for those. And it's not fair if you write them down. Okay, so another technique is to really work on coping, acceptance, and adjustment. This is also a very important thing to help patients with, because no one comes through cancer treatment looking like they spent a month at the spa. And so we want survivors to use areas of cognitive strength to compensate for areas of weakness. And we want them to recognize that things may need to be done differently and that they're going to need to keep working at it. So it's not always easy to create new habits, but the more a behavior can get tied to a memory, the easier it is to recall. So, for example, reviewing your day while you're brushing your teeth, or using an appointment book and checking it every day and writing things down. It goes into people's brains differently when you are handwriting something versus typing it into a phone or a computer or whatever. And then other times for some people, we suggest that they write at night in a memory journal about what happened and what they talked about during the day. So if they're not focusing on what they've lost and they're really working on building these compensatory strategies, it's going to help them tremendously. So one thing that has to happen is patients need to readjust their expectations. So it's so important to help survivors to relearn to trust their brain, because the more they can be relaxed, the better it is going to be for them when they need to retrieve the information they're looking for. I did testing. I went to neuropsych, had testing, and I tested within normal limits, actually tested at like higher than normal limits for almost everything. And what he said to me was that I had to relearn to trust my brain. And once I really internalized that and realized that that information was there, remember the file cabinet I was talking about, that helped me tremendously because I was able to relax more instead of tensing up when I couldn't remember things. And I was no longer focusing on how much the symptoms were bothering me. And I was plenty mad. The more I was able to laugh about it, and it helped me build awareness and it helped me work towards adjustment. And the reason why I use the word adjustment instead of acceptance is it's a lot easier to get to adjustment than acceptance. And why should I accept the fact that the very thing that saved my life also might have ruined my life? That's a little hyperbolic, but you know what I mean. So it's when people are less stressed, it's easier to think. And when they are able to laugh about things that they can't control, that increases coping. And keep in mind, patients are hyper aware of their problems, even though others are less likely to notice. Another thing that's super important here is helping patients process their grief because not all losses are apparent at first. It's not as simple as they lost a body part or they have a scar, they lost their hair. But patients lose a sense of invincibility. They've lost control over their bodies, control over what's going to happen, their sense of normalcy, who they were before their cancer diagnosis. And just like with the onset of CRCI, there's so much going on in the beginning and during treatment that patients typically haven't processed grief until later. So it is often until the survivor has some breathing room and space that they're able to process and grieve what has happened to them. Managing the mind, I think we all spend a lot of time talking to patients about this, and this is super important with CRCI as well. So first off, it's important to share with patients that it may be hard to believe, but things are going to get better. Keep in mind, it can take about 2 years for patients to find their new normal after the end of cancer treatment. And so helping them understand that and normalize that is super, super important. And again, CRCI is often just one more loss that they have to process. So providing reassurance is important and helping people see the humor in the situation that happens. A key technique that we like to use a lot is decatastrophizing and realistic probabilities. I challenge you all to type decatastrophizing multiple times on slides. It's horrible. Anyway, these worries and fears that people have about some sort of catastrophic outcome because they've had a memory issue or an attention issue or a word retrieval, all of this embarrassment stuff, this is very, very prevalent. People talk a lot about what might happen in very catastrophic terms. So it's important to help people decatastrophize. And this technique is super simple. It is simply asking, then what? So a patient says to you, I'm afraid that if I forget so-and-so's name when I meet them at a meeting, that they're going to think I'm terrible, incompetent, and I'm going to lose that client. And so you ask, okay, so what happens if you don't remember his name? What's going to happen? Well, I'm going to be pretty embarrassed. Well, what are you going to do then? I'm going to have to ask them for their name. And then what? Then you're going to say, I'm sorry I forgot your name. And they're going to probably say to me that they forgot my name as well. So what you do is you de-escalate by using this thing. And what happens a lot of times is that people with catastrophizing, they tend to try to avoid following through what might happen because it creates so much anxiety and distress. But when they take and they do this active problem solving by then the then what or what then question, it helps bring that stress and anxiety down. So we also want to help patients keep things in perspective. And so 3 things that I focus on with patients all the time is grounding. This is using the stop technique, and this is very simple. It's you have when there's a moment, you have them stop what they're doing, take a breath, observe what's happening in their body, emotions, and mind, and then proceed to what's the most important thing right after that. Humor is another thing that is super important because it helps people relax, it helps normalize the experience, it helps people retain and share information. So that's really, really critical. And then gratitude work is also important because that act of seeking things to be grateful for is probably as important, if not much more important, than actually finding that. So, and that activity sparks this brain activity that helps with sleep and mood regulation. But keep in mind, these things have to be real. They can be any size. Like, I'm so glad that the pumpkin latte is back at Starbucks or something like that, right? So it can be as simple as looking for 3 good things or 3 things that went well during the day. And in the resources is a whole thing on gratitude in there and many, many other things as well. Communication is critical. And as healthcare team members, it's so important for you to ask about this. Patients can be embarrassed. They're typically embarrassed and anxious. They may think that they are losing their minds. All of these things are so important for us to normalize, to listen and support their complaints, help them process their experiences, advocate for a treatment change if necessary. Maybe they need to change their AI. Maybe they need to, if they're still in chemo, maybe they need to be on a lesser dose, all of these things. Make sure you're checking to see if there are other medical problems that can be causing symptoms or things that you can do to alleviate things, the comorbidities. Refer to a speech therapist or a neuropsychologist. Now, I tend to prefer to refer to the speech therapist because A, it's easier to get them in, and B, what happens with the neuropsychologist is they do the testing and then they refer to speech therapists for treatment. So why not cut out the middleman? So I think it's really, really important for us to keep this in the forefront of our minds and to make sure that we are opening up this conversation with patients. It's also important to recognize the struggle of the loved ones because the survivors will often complain that their loved ones don't understand that hey, I finished treatment, they think I should be over all of this, but I'm not. And the loved ones often feel that they can't complain to the patient. And so this frustration adds these additional levels of stress and burden to already emotionally and physically exhausted patients and families. And it builds walls instead of creating a stronger team. So let's hear from Milda again about how her family handled it.
How did my family handle my memory issues? My husband did not take it well. He had been wonderful in taking care of me when I was going through chemo and really handled more than his share of work. But when I was done with treatment, he felt that things should go back to normal, and certainly they were not normal at all. I was dealing with all this distractibility and forgetting things left and right, and he became very, very irritated with me, even angry, sometimes yelling at me, um, because he didn't understand what was going on. To be fair, I didn't either, but he just really didn't want to hear excuses. and this created a lot of friction in our relationship. Probably it was the most contentious time throughout the entire cancer experience that I had with him, because we started fighting quite a bit. And it took a while for him to finally understand. And when I say a while, I mean years for him to understand what was going on. I'm glad he stuck with me during that time. But the definitely having the memory and attention adaptation training class to point to, like, see, I'm not the only one, that helped.
So it's really important for patients to learn how to talk about their CRCI. They're not obligated to explain themselves, but we want to encourage them to provide structure to others and set clear expectations and guidelines about what can be managed, when it can be managed. That's going to make life easier. Setting limits and communicating if they don't have enough energy or brain power for something. I always suggest that they consider a phrase or a sign for close families and friends when they are having this chemo brain moment. In my family, I would say, I'm having a chemo brain moment, and they would literally throw their hands up and back off like I was a bomb that was going to go off. And they would give me the time. And so it was really, really helpful with that. Returning to work is often a challenge. People often worry that they're not going to be able to return to their pre-cancer situations. They don't trust their brains. And so it's so, so important for them um, to be mindful of the stress and what stress does to their cognition, and help them explore whether or not there's some accommodations, maybe like recording meetings or organizing their work area for better concentration. Energy management is super critical here as well. We want to make sure that we're addressing their fatigue and sleep, because we know that stress and cancer treatments impact sleep. We know that cancer patients and survivors have higher incidence of sleep disturbances and insomnia. And we also know that cumulative months of poor sleep impacts thinking. Any of us have experienced that without having had cancer. And the pacing is something that's really important as well, because pacing here is a strategy of performance enhancement and not a performance compromise. So the goal here is not to give up or slow down, but to minimize fatigue by valuing certain things and prioritizing things and recognizing these limits of both physical and emotional energy, because that prevents this exacerbation of that stress cycle. So help patients determine what they need to do, how long it's going to take, and encourage them to be hyper realistic. I have always been, this is not a cancer related thing, very, very poor assessor of how long something's going to take me. And so I will typically on a weekend go, oh, well, I've got this thing of 12 things. We should be able to get all of these things done in 45 minutes, when in fact, just one of those things probably is going to take all day. So it's really, really important to work on them on being realistic. You can talk to them about the spoon theory, which is a favorite of mine. I'm very excited about this. I encourage you to Google that, or you can email me and I will send you information on the spoon theory. But this really speaks about the fact that everybody has a certain number of spoons available per day, and each activity takes 1 to 4 spoons. And so if you think about it, if a normal amount of spoons is 12, and you think about each activity that you have to do every day, you may run out of spoons before you've hit 7 p.m. And then borrowing spoons from the next day can create an issue. So this is a really important thing. I like spoon theory because it gives patients language to explain energy and fatigue to other people and to be able to communicate better. Okay, so in closing, I have a question for you. Here's another poll. I want to know, how many items did you recall? And did you use your body, or did you use your home? Did you make items absurd um, or exaggerated? So here we go. See what you've got. Oh, well, I should tell you what the items are. That would be helpful, right? Carrots, bag of frozen peas, a gallon of milk, duct tape, toilet paper. So while you're answering, I will actually tell you why I love this. I have, well, a couple of things. One of the things you can, when working with patients, you can have them describe their home to you and or a route that they would be taking. Especially if they have difficulties thinking of rooms, you could suggest other locations within their home. Other options would be to use different body parts or even a familiar route like a commute. And they can use this visual template the same every time. So I use my hand. I use the palm of my hand, especially because usually I only need to remember one or two things. And so I, for example, would forget to take cherries that I bought to work. And I'd always remember in the shower, right? So I didn't have any place to write it down. So we had just taught this class and I was like, oh, cherries. And I just hit my palm of my hand. And so because I use my hands a lot and I motion with them and stuff like that, I recognized or could see that when I saw my palm, I go, oh, remember to take the cherries. Another option is you can actually like pinch your thumb and your forefinger or something and say, I want to remember this and this. So it's something about the tactile response. So it looks like we had about 39% remembered all five and 28% four. And let's see, a lot of people use their home. That does tend to be a favorite. Less use their body. And then about 26% made them absurd and others did not. So there you go.
Linda,
Yeah.
I do just want to let you know we're about 2 minutes over.
Oh, sorry. I just have one more slide then.
Okay. And then we certainly want to leave any time for questions and questions.
Okay.
Yeah, great. Thank you.
Yeah. So just a few things here. These are things that you can do to help people. Highly recommend getting these books, Memory, Attention, Adaptation Training. You can get them from Amazon. There's a clinician manual and a survivor's workbook. And again, identify at-risk situations and script responses, engage their support system. And then I did want you to hear from Dana.
So I was moving forward work, and I feel like I lived two lives at the same time, where at work I was really seeing this growth, and at home is where I was crashing, and where I think my family maybe in the beginning were more dismissive, like it was always about like, but look at, you're survived, you're here, and we don't notice it. And so the emotional support really came from other breast cancer survivors who could relate and empathize with me. I think the other part that was emotionally hard for me, even throughout the years and up until I took the course and learned ways to explain to my family what I was going through, was the whole walking into the room and forgetting what you're in there for, or I would repeat and ask the same questions again, and then being told, well, you've asked me that 3 times already, why do you keep asking me that? And then me getting frustrated and saying, if I remembered the answer, I wouldn't keep asking you the same question over and over again. And so emotionally it hurt because it was frustrating. Nobody likes to feel like they're not their complete self. So on one hand, you have this celebration of how far you've come and this gratitude for where you are. But I've learned you can also have that gratitude and have that success and still be frustrated on a daily basis. But what the class helped me was to really identify it and start taking some of the control. And while I think I had a lot of the tools in my toolbox, because I was proactive in seeing somebody in the very beginning at the cancer center, I was familiar with doing some podcasts and I had a lot of support from the breast cancer community as well. But and honestly, when I signed up for the course, I think I even prefaced it, I'm 5 years out, do I even still qualify? Like, I wasn't sure if I would qualify, but I knew I needed it, and it was helpful. So I was.
So takeaways. Patients and survivors don't need to feel lost, isolated, and frightened. So create a program doesn't take a lot of work. Having expertise in helping people is easy as following the curriculum laid out by Ferguson and Gillick. Partner with a speech and language pathologist, add in components that your patients bring up, and please feel free to reach out to me without any with any questions.
Thank you so much, Linda. If anybody has any questions, please put them in the Q&A box. We did have one great question that Kelly did answer about. We do have some, frankly speaking, on chemo brain, not certainly to the extent of Linda's presentation, which was so fantastic, but it's certainly a place to start. And I do just also want to mention that the resources and books and everything Linda mentioned is in the resource tab, and a PDF is available for you to download. So I just want to leave it for a few more moments. I know we ran over a little bit, so I thank you all for being patient with us. This was such a great presentation, and just really great practical knowledge I think we all can take with us and help with all of our patients and caregivers. So thank you so much.
Thank you, guys.
Yeah. So if we don't have any questions, that'll mark our, I'm sorry.
There's a question about where the resource tab is.
Oh, okay. Oh, that one didn't come up for me. Oh, there it is. Okay. So the resource tab, for me, it's right on the bottom of my little bar, like, there's the chat box and the reaction, raise your hand. And one of those tabs down there does say resources. I don't know if that helps, if everybody can see that. There might be a more button on your bottom bar. If it's not there for you, there's like a little round button with 3 dots in it. You might have to click on that to see the resources. If anybody has a problem getting them, let us know, and we will certainly be able to get them out to you. We can share them with you all afterwards. So that will mark our time together today. Thank you so much, Linda, for being with us, and thank you to our audience for joining us for day 1 of POPS. As a reminder, the session is recorded and will be available for viewing on Cancer Support Community's Zoom Events Hub and the Cancer Support Community Learning and Training Program website through February 10th, 2025. PDF versions of the presentation materials, slide decks, and handouts will also be shared with attendees following the event. Please note that all session recording and resources will be available after the event and for more informational purposes only, but you're not going to be eligible for any CEs if you're not here live. If you wish to receive continuing education credit for participating in the session, please complete the online evaluation form. The link to this form will be made available after every session, but please note that you only need to fill it out once to claim credits. If you have questions about the CE activity, please contact Prime at the email shared in the chat. Thank you for joining us. Thank you to the Leukemia and Lymphoma Society, Sanofi, and IPCEE for sponsoring this event, and we'll see you all tomorrow.